Today, we're doing an injectable makeover for Miss United Kingdom Supranational 2012. Hi guys, welcome back to the channel. My name's Dr Sarah Tonks. I'm a cosmetic physician in London. Today I am going to be doing, well, the same thing that I do most weeks, which is an injectable makeover on an already gorgeous woman. As you know, I have had a number of pageant winners and beauty queens on the channel before, and the challenge for me always is, how do we take these already super attractive women and give them just that little tweak so they have that extra edge? The answer, of course, is in planning the treatments, taking measurements, taking pictures, and I guess knowing where you have to put the volume. So let's go over to our patient. Now you're probably looking at this lady and thinking, gosh, really, where do you start in something like this? Well, I have to tell you guys, in the end, we actually used something like 13 mils of hyaluronic acid, which seems crazy looking at her, right? But let's go over it and I'll show you what was done. So the first thing that I notice is the hollowness in the temple area. And it seems silly, but actually that makes a really huge difference, because when you fill the temple, it tends to have the effect of changing the position of the eyebrow, and it also subtly changes the cheek position as well. And what I'm doing now is just assessing where she's got light and shadow. So we've got some shadowing here across the chin. There's a little bit of shadowing here as well in the front part of the face. And have you noticed there's a sort of very small amount of lip asymmetry? So it's almost like there's a slight depression there, and this side seems a wee bit lower. A lot of people come asking about the under eye area because they feel like it makes them look tired or sad. And this is something which I kind of have not exactly strayed away from doing on YouTube, but I have made a concerted effort with my more recent videos to show you guys more results from doing under eye fillers. The reason why I don't really show it on the channel so much so far is just because it's not my favorite thing to do, and you know, it's my channel. I can do what I like, right? Okay, so let's just head straight over and talk about what was done. So I started, of course, with the old classics, which was doing a bit of Botox in the forehead. I know she doesn't really have very much in the way of lines and wrinkles, but often people still like to have it if they do see that the lines are starting to get a little bit ingrained in the skin. And in this way, it's more preventative. I've also done some in the mentalis muscle and the DAO as well. So now I'm going to use some Juvederm Voluma, and we're injecting the temple. I've put 0.5 ml per side. The next thing is the cheekbone, and again using Juvederm Voluma, I've put 1 ml per side. Then I went back and put another 0.5 ml in each temple. So that in total came up to 4 mils. Let's take a look at that image. So with just the temples and the cheekbones treated, you can see that the face has taken on more of a, I'd say, heart-shaped appearance because she's now wider here and at the cheekbone. You'll note that I've also put some topical anesthetic on her lips. That's not something that I do super often, although it is available. Okay, so next stage. Now I'm using Juvederm Vol Lift on the chin crease. And we used a total of 1 ml here. I went over to Juvederm Volbella for the lips. The first thing that I'm doing is treating the medial tubercle from above, and then continuing this method of upper lip tenting all the way across the upper lip. The next thing is to inject the Glago-Klein point to emphasize this. Then we go and treat the lower lip, middle third, and it's the middle third to make this middle third the fullest section of the lower lip. Otherwise, it can look a little bit like a slug. One tip is to squeeze the lower lip, middle third, to really bring that forwards and emphasize it further. Using again Juvederm Voluma, back to the mid cheek, we use half a syringe of Juvederm Voluma per side. Let's just take a look at that picture. So this is now 8 mils. Sure, we've got some swelling in the lips. That's normal, guys, okay? Remember, that swelling, it really depends on the person. For some people, the swelling will go down relatively quickly. Other people are swollen for 5-7 days, maybe even more. Now we're going to start treating the tear trough, and I'm going to use TSL Redensity 2 for this. And I've used a total of 1 mil underneath the eyes. I'm also putting some underneath the left eyebrow with a cannula in the A-frame region. And this is one of my favorite things to do, actually, because it's kind of tricky, which makes it quite fun. I do find though that sometimes patients don't like it because it makes the eye appear slightly smaller. The fact is, in some people, as you age, actually this distance becomes bigger and the eye can therefore appear more skeletonized. So by putting filler in and reducing this distance, it actually makes the eye appear more youthful. But I think a lot of people have got this sort of paradoxical view that having a smaller eye is less youthful. And that's certainly true if you do have a lot of overhanging skin there. Then I finish up using some Juvederm Vol-Lift in the marionette region. I haven't really shown very many noses on the channel. It's just because of the way that the videos until now were taken. So it's difficult for me to show you a side view, but nevertheless, I treated her nose. And the whole point of this is to make the nose appear straighter from the side. I used 0.5 mil here and then just popped the rest in the central chin. So now we've used a total of 12 mils. Let's take a look at the picture. One thing that really strikes me here is the A-frame region. So just take a look at that and how different this section looks. It's definitely my favorite thing, which we can see on this patient. And see also how the face just looks more delicate. It's more of a V shape. I finished off using some Profilo, which is a type of injectable moisturizer. It's 5 injection points on each side of the face. And I also used some TSL Redensity 1 underneath the eyes. So we used Redensity 2 originally, and then Redensity 1 to finish up with. And they're very different. The Redensity 1 is more for skin hydration and skin improvement. Okay, so let's take a look at our results. Can I just say one more time, I'm loving those eyes. I think that's made a huge difference. Can you see the way that the overall shape of the face has changed? I mean, she looked great before, but now everything just looks kind of a little smoother, almost airbrushed. We've got more definition in the chin point, and the whole face has just become more oval. The lip is definitely more symmetrical afterwards, so you see the volume has been taken from one side and it's much more centralized now. I think that looks really nice. And although we are looking at this from the front, you can see that the nose looks slightly slimmed as well. Okay guys, so that's it for this week. I hope you enjoyed the video. Let me know what you think of the makeover in the comment section below. And don't forget to subscribe to the channel if you've enjoyed the content. I'll see you later.